Hey, good evening. Almost 9 o'clock. Coming on a little late. Just going to answer one question tonight. My name is Dr. Andy. I am a physical therapist. I treat all kinds of musculoskeletal stuff in person in Greenville for the company MyoMove. I also have a strong passion for people who have persistent or chronic lower back pain. So I like to come on here, get on Reddit, answer some questions, and replay these for people. I'm just trying to help as many people as I can. So if you are struggling with persistent chronic lower back pain and have questions, please send them, post them. I haven't quite figured out how to answer questions like live as I'm doing this. I mean, the chat doesn't really seem to um, work for me. It's just a new thing I'm doing. So this is just my third time going live. But the biggest thing is I saw a post on Reddit. I want to talk about some of the things in there that you might find helpful as well, especially if you're dealing with acute back pain. So let's dive right into it right quick. Okay, so the question is, how do I help my husband? And right off the bat, this is a back pain case that started about a month ago and seems to only have been getting worse. Anytime that this gentleman moves from the couch, he's in extreme pain, and obviously this this person is concerned for their husband. They went to urgent care, got an imaging. They said he has mild degenerative disc disease, which if you have seen any of my other uh, lives last couple days, that is very common, especially as we age. There is to be seen a mild disc herniation, and he's in excruciating pain. It looks like they've tried a TENS unit, maybe some gabapentin. That's another topic for another time. And it seems like the pain is only getting worse. So it's good that they've got PT scheduled and MRI in a couple weeks. So we're probably looking at maybe a 6-week timeline for the MRI. She's concerned about doing anything in the meantime. There's absolutely stuff that you can do in the meantime, whether it's breathing exercises, laying on the ground, and just getting some motion through the back. I'm actually going to send this person a video exercise that I give to people for their back pain that might be helpful. Wondering if she's taken to the ER. It's hard to watch him in so much pain. It definitely is difficult to see a family member who's struggling and not really know how to help. So, what I want to show today, also something that I've mentioned before, is the Choose Wisely campaign. I think it's called Choosing Wisely campaign. I'm going to go ahead and share that screen for us. Okay, here is the Choosing Wisely campaign coming from Family Physician Association. Here's what they don't recommend, and this is something that the research is showing consistently, is that there is not a recommendation for imaging for back pain within the first 6 weeks unless there are red flags present. And again, always should be seeking medical attention if you're unsure and talking with your medical providers. This is obviously is not medical advice. I'm just demonstrating and sharing information that somebody else might find helpful or resonate with. So the red flags that they're looking for is progressive or severe neurologic deficits, so spontaneous weakness, inability to use your legs or walk or stand, any seriously underlying conditions such as infection of osteomyelitis. So again, some of the red flags that we're looking for as a physical therapist are: can you get into a comfortable position, even if it is brief, just by changing positions? So this gentleman's at a 9 out of 10 pain. Can he just roll to his side, and for the next 20, 30 minutes, it's a little bit more pleasant. It's a little bit more tolerable. Still very high pain, I'm sure, but can you get some relief in some position? Is it, child's pose? Is it laying on your back? Is it laying on your stomach? Is it laying on your side? Is it standing or walking? I've seen tons of people with acute low back pain have different symptoms and different ways that they get relief. So that is one of the things that we look for. If you cannot get into a comfortable position at all, not even a little bit, definitely, seek help and just some of the things I'm going to talk about now will start to make sense why we want to avoid imaging so quickly. So the I'm just kind of quickly looking through this. Um, so this first little paragraph is just talking about how there's some differential diagnosis required to make sure it's not organ related pain like GI or pelvic disease, tumors, cancers, those things like that. And if there's bowel or bladder dysfunction. So if those are the red flags that they're kind of looking for. If you do not have any of those serious things, I like to tell people that 99% of back pain is not a real statistic. Pretty close, I'm sure, is not serious. And that's because most people are not having these types of symptoms. So most patients with radicular symptoms will recover within several weeks of onset, and the majority of disc herniations will regress or resorb within 8 weeks of onset. So if you rush to get imaging, when we have substantial supporting evidence, it's been a long night, substantial supporting evidence that we don't need to rush off because the body's really good at healing itself, then then maybe getting imaging right away is costly, right? We have pain. Okay. We also have studies that show, here's the next sentence, that patients with no back pain often have anatomic abnormalities incidentally, right? Degenerative disc disease, wrinkles on the skin. You'll hear me say that a lot. There are risks associated with routine imaging, radiation exposure, patient labeling. That's an interesting one. So the labeling phenomenon is is something like if you are given a diagnosis, you're like a living diagnosis. You're a walking arthritis. You're a walking herniated disc. Yeah, I'm an L5S1. Like that carries weight. And what this study here's, referencing is that it can often awesome. I'm not even sharing the screen, I don't think. Just realized gone 10 minutes. Not even sharing the right screen. Here we go. There it is. I'm going to share this link anyway. So don't sweat it. But this is, again, coming from AAFP. It's a physician organizational website. Patient labeling, highlighting just for my own sake. I love that. Okay. It can absolutely carry a burden and affect people's well-being. That's been studied. So increase of imaging, the likelihood of imaging is going to increase the rate of a rush off to surgery. There are surgeries that show maybe I should stop doing lives at 9 p.m. There are studies that show uh, there's an increased rate of surgery almost eightfold after getting an MRI. So if you think about MRI imaging results being incidental findings, possibly in people who are asymptomatic, you're not going to rush off to give somebody surgery if they're not having any loss of function or pain or disability or debility, right? If somebody's asymptomatic and you image their back and they have a bulging disc, you wouldn't do surgery. You just would be like, well, let me know if you have a problem. So what this study is showing, or referencing, this site is referencing, is that there's an eightfold increase in risk of surgery. Risk of surgery. Surgery is not a walk in the park. So um, an interesting meta-analysis that found that there's no clinically significant difference in patient outcomes between those who had immediate lumbar imaging versus usual care. What is usual care? Usual care is usually conservative. Imaging of lumbar spine before 6 weeks doesn't improve outcomes, but does increase costs. I mean, uh, what you guys missed earlier was that low back pain is the fifth most common cause for all physician visits, and people are going to rush off to imaging. So a lot of what the Choosing Wisely campaign is for physicians to help understand that hey, there's all this research and evidence that maybe suggests we don't have to rush off to get imaging because there are risks associated with that. So, coming back to the Reddit question, if we don't have severe progressive neurologic deficits, fever, sudden bowel or bladder issues, trauma, other underlying, um, you know, diagnoses, like if somebody has a history of cancer, you're always going to be curious or wondering about metastatic or, uh, spreading of the cancer, right? So, you can have back pain for certain conditions like that. Okay, those are things you wanna rule out, but we're looking at the full clinical picture. If you don't have red flags, typically it screams musculoskeletal or that herniated bulging disc, and conservative management is actually really. So, when you're in the thick of it, just to kinda wrap up, you're having all this pain, all this discomfort, it sucks. Yeah, I mean, that's essentially what this person is watching for their husband, and they're going through it. Have hope, okay? Find ways that you can move that are comfortable. Find some deep breathing exercises. Go to YouTube or ask me. I've got some already made and hang in there because it will get better, right? If right now is rock bottom and it's the worst, it it will get better if we stay positive, understand that rushing off to get imaging, rushing off to get surgery without trauma, without all these other red flags is really no better than conservative treatment as long as it is a true musculoskeletal condition. So, hopefully that is helpful for somebody. I'm trying to get the message out. If you know someone that has back pain, please share this with them because it might be educational, it might be informational for them, and it could save them time, money. And I'm really just trying to get the message out there to help as many people as I can with back pain. So, thank you for tuning in, whether it was live for 1 second. I saw the tick come up. A couple people showed up. This is not a podcast about gardening. It's not a podcast at all. So again, hopefully you found this helpful and please reach out if you have questions. Thank you.